Hi, everybody. Welcome to the research updates that we do twice a month. I'd like to get together with you to let you know what papers have been out there, what research is being done about lipedema. So it's wonderful to be with you here. I just returned from doing a meetup with Siobhan Huggins at Keto Chow in Salt Lake City. If you don't know anything about Keto Chow, check that out because I think it can be a benefit to some people with lipedema. But today I want to go over this paper with you that I came across. It just came out in March of 2023, and the paper is called "The Role of MTHFR Polymorphisms in the Risk of Lipedema." So it's looking at a particular gene mutation, and the MTHFR gene, and some of you might be already familiar with that gene. It was published in the European Review for Medical and Pharmacological Sciences, as I said, in 2023. It was a collaboration between actually 3 different countries: Italy, Jordan, and Australia. One of the authors is from Australia. The study itself was performed in Italy. So what were they trying to learn with this study? So they really aimed at looking at that potential relationship between having that MTHFR gene mutation and lipedema. So they're wondering if having that gene mutation would increase the risk of developing lipedema, and if the appearance of this gene might be a biomarker that could help differentiate between simple obesity and lymphedema and lipedema. So got some interesting findings in this study. I think you'll be interested in this paper. I do have the full paper myself. If you cannot get the paper, go ahead and email me, leslyn@lipedemaproject.org, and I can send you the full paper if you would like to read it yourself. So first, just a little bit discussion about this MTHFR gene. And it has quite a few variations, some are which are called actual mutations. And it has been studied extensively as it relates to obesity. So a particular variation or mutation seems to be associated with obesity. Let's see what else they were looking at here. Because it seems like if you have this particular variation, you tend to have elevated homocysteine levels. And those elevated levels seem to be correlated with having obesity. So they wanted to look and see if it also had those correlations with lipedema. It's also interesting that this gene has also been associated with increased risk of other diseases like high blood pressure, blood clots, miscarriage, psychiatric disorders, and some cancers. So this gene has been looked at a lot. And that's why I was thinking a lot of you may have even heard of the gene. Let me just make sure I'm looking at my comments in case any of you have anything to say. Thank you, Marilee, for posting that you're in the sunny Pacific Northwest. Go ahead and comment in there where you are in the world. I love to hear from you and know who's out there. Oh, hi, Miriam. Nice to see you. And also Miriam posted what the MTHFR gene, what that acronym stands for. I was pretty sure I was not going to be able to pronounce it, so I'm just using the acronym. Let's see what else they were talking about. Oh, how interesting. I did not know this. It seems to be a higher incidence of these gene mutations in Italian and Hispanic populations. Didn't know that. And it seems to have a lower prevalence in African American populations. I didn't know that. But other concerns that you might have heard of associated with the MTHFR gene is that it is also, as far as nutrient absorption, for those of you that are interested in the nutritional aspects, you have difficulty absorbing folic acid and some other vitamin B, important vitamins, B vitamins. And so if you have this mutation, you may need to have some supplementation or to help make sure that you have the appropriate levels of your micronutrients. So it has a lot of implications just for health in general, but it may have implications for lipedema specifically. So what are the methods they used for the study? So they had 100 participants that they recruited from this particular university nutrition and biomedicine program in Rome, Italy. And the criteria is that they wanted them to all be Italian and Caucasian, I guess because of the higher incidence of the gene mutation in that population. And they need to be between 18 and 65. And they had some exclusion criteria. And so 5 women were excluded for things like pregnancy, breastfeeding, infectious disease, etc. They had several specific things that excluded you from the study. So they had 95 that were then divided into groups. And they divided them into 2 groups depending on whether or not they had lipedema. So they had 45 in the lipedema group and 50 were women without lipedema to compare with. And so what did they assess? And so they stated here they did it after a 12-hour overnight fast because they were doing, looking at DNA and stuff like that. So they did a 12-hour overnight fast, and they did the body weight, height, waist and hip circumferences, and then they were able to calculate BMI and waist to hip ratio. They did body composition using a DEXA scan. So they did lean and fat percentages and mass. And then they did a DNA analysis using a saliva swab. So once they did the DNA analysis and they saw who did and did not have the MTHFR gene mutation, then they actually ended up with 4 different groups to compare because they had people with and without lipedema. And then they had people with and without the gene mutation. So you had, for instance, positive for lipedema and positive for the gene mutation, or positive with lipedema and negative for the gene mutation. So they ended up with those 4 groups that they compared all of those to each other. So interesting, when we look at the anthropomorphic measures, the weight and the height and the BMI and all that kind of stuff, and we compare those, the only thing that wasn't significant between groups was, and just looking at the lipedema group between the comparison group, the only thing that wasn't significant was the age. Everything else was significant in all those other areas. So for weight, for BMI, for waist, the waist, abdomen, and hip measures, all were greater in the lipedema group, as we would expect. And also, as we would expect, that waist to hip ratio was better or lower in the lipedema group. That does tend to be better. We have less abdominal obesity, and we have better, usually a marker of better metabolic function in that group. So it was 0.73 in the lipedema group versus 0.79 in the comparison group. But then when we compared groups together, we had some interesting things that came out. So the most statistically significant differences between groups was the 2 groups that had the MTHFR gene mutation. So they either had lipedema or not, but they both had that gene mutation. And so the lipedema group that had the MTHFR mutation had a higher weight, higher BMI, higher hip circumference, more fat mass in the legs, and a lower waist to hip ratio than the group that did not have the MTHFR mutation. They did not have lipedema or the mutation. And so it showed there was that positive correlation between having the mutation and getting fat on the lower body and having a lipedema diagnosis. But also the interesting comparison was in the 2 lipedema groups, one having the mutation and one not. There was also interesting things there. So being positive for the mutation and having lipedema, you had more fat mass. There was significantly more in the legs. So those leg measurements, those lower body measurements were larger in those that had the mutation. Also, that the gene mutation group that had lipedema versus not having the mutation, they had higher weight, BMI, waist, abdominal, hip, and lower leg circumferences. All that was greater in that. So it just seems like if you have lipedema and the mutation, it could, maybe it's correlated with more severe presentation. So the authors, as always, they should always talk about what the limitations to their studies was. And so this group, they did acknowledge they had a couple of limitations. One is the sample size was small. A lot of times, at least 30 people in a group can give that study a lot of power. And this one had 45 and 50. So I thought that the sample size was pretty good, but always having more can really help. And they say that they were concerned about it being small was due to the difficulty in getting lipedema diagnosed, which is, I think, worldwide an issue, trying to get a diagnosis of it. And also having the confusion between lipedema, lymphedema, and obesity. And so it's sometimes hard to get a good sample size just because we don't have a lot of lipedema being diagnosed. And then also another limitation of the study is that there are actually many MTHFR gene mutations, and they only looked at one, and they looked at the one that was most highly correlated with obesity. But by looking at that one, they were able to find some interesting facts, but it still remains unknown what those other variations might show. So what are their conclusions from the study? So they said that this study might give some preliminary, potentially very interesting links between the MTHFR mutation and lipedema. So they conclude that there's an association between MTHFR mutation and body composition in Italian individuals with lipedema. Really can't generalize it out to everybody. MTHFR mutation may increase the risk of lipedema by as much as 2.85. That is quite an increase in risk. And then testing for MTHFR mutation may be a helpful tool for actually diagnosing lipedema. And if you have it in your family, by a tool that can be used for assessing your risk of developing lipedema for other members who don't have it, but you're worried that they might get it. This might be a tool for helping to assess what are your risks, the level of your risk. So I feel like this was a pretty significant study, which of course we need to do more, but this really starts us on the road to thinking about different ways that genes may impact lipedema. And this is another way that it might have an impact. It could potentially be used as a biomarker, not only to help us differentiate between obesity and lipedema and lymphedema, but it also might be used to help us be able to talk about what is your risk of developing lipedema. So I thought it was a very interesting study to read. And I'm just going to look at some of those comments because you got a lot of people saying stuff. Thank you so much for posting. I always like to know that I'm not here by myself. Maria is here from Greece. Wonderful. Amanda from Indiana. And Jennifer says she can't see the comments. I'm not a tech person, so I'm not sure exactly why you can't see the comments. And Miriam points out that MTHFR, it's easy blood test to do. I actually found mine by doing a 23andMe type thing and was able to see it from that. And Cheryl is in Wisconsin. Okay, Jennifer fixed it. She can see the comments. And Miriam, you point out that you can find the methylated B vitamins that can be used. So, and that was the issue. It's better to have the methylated vitamins, and that might be the issue with the MTHFR gene. And let's see. Oh, Julie's here, my neighbor in Camarillo, California. Hi, Kathy from New Jersey, and Ivani from Brazil. Shelley says she has some Italian ancestors that have the MTHFR gene mutation and lipedema. Interesting. So even anecdotally, we can see those connections. Sue is from Indiana. And Miriam said that she had heard of the MTHFR. It's out there, it's talked about, but she didn't know it contributed to lipedema in Italians. Yeah, that's the thing, is this study, they were really looking at those who had Italian heritage. I didn't know that it was more prevalent in Italian and Hispanics and less prevalent in African Americans. I thought that was an interesting thing I learned also from the study. So just a real quick, I wanted to share with you something that we've got coming up. We have a coaching special interest group, or we call it a CSIG, coming up starting July 31st. It's going to be on Mondays and Fridays at 5 p.m. Eastern. It is called A Holistic Approach. There is more to you than meets the eye. And so it's going to be wonderful with expert speakers coming in to share their information, including myself and Siobhan and many others are going to be talking about different aspects about lipedema, but really looking at that there's way more to you than just your lipedema, than what just meets the eye. So I think it's going to be a fascinating group, and hope you can join us. I think there will be a link. Yes, there is a link down there for you to be able to find out more information and register starting on July 31st. And I see that Miriam says question. So maybe you have a question. Go ahead and post that. Oh, is there a calendar where all of these live streams are and that I can find? Yes, it is on. And I don't know so much that there's a calendar, but it is on lipedema, the disease they call FAT, is that we have the announcements there, and we post the video of this, the replay, so you can watch it later if you're not available. I typically do my research updates on the first and third Thursday at this time, 12 noon Pacific, 3 p.m. Eastern, except if I have a conflict and then we have a different schedule. So I think you should be able to find out from that Facebook group, the disease we call FAT, should be able to give information there. And also Maria says, is lipedema or lymphedema reversible if an obese person loses weight? So what we're finding is that many women with lipedema also have obesity. Not all, but many do. And it does lessen the impact on the body, make the body healthier if you are able to lose weight. Is lipedema and lymphedema reversible? It definitely can be. The progression can be halted or reversed, but can you be without the condition? Can it be in complete remission? That I don't think so. I think that once you have it, it is going to be a condition that you have the rest of your life, but it doesn't mean that it has to continue to get worse and progress. You can stop it where it is right now, or even have it, the symptoms reduce significantly, but you probably still always will have lymphedema and or lipedema. So, but there is a lot in just, I would say, the last 5 or 6 years, tons of research being done on lipedema. We're finding out more about what causes it, what triggers it, and how to control it. There is much more hope than there ever was ever before, just with that explosion of research. And one reason why I decided to do these twice a month, to let you know, and on the newest stuff that's coming up about lipedema. So there's a lot you can do. And this CSIG that we're having starting on the 31st is going to be talking about some of those things. It's for you that like a recipe and you want to know, here's a checklist of everything that I should be doing to manage this condition. That is not possible because it really needs to be individualized for you. So we're going to be talking about that a lot of people respond to this type of strategy. A lot of people do well with doing this, and you may need to change it a little bit like this. And that's the type of thing you'll find out in this course and in other courses that we offer. And you figure out how to individualize it for you, because it is such a different, it presents different in different people, and your strategies are going to have to be different. So it's hard for us to say, this is everything you should do. Traditionally, how I was trained is that everybody should have complete decongestive therapy done 5 times a week for 3 to 4 weeks. But Siobhan has just been treating her lipedema once a week with her certified lymphatic therapist and doing very, very well. So it's just, we can't say that this is exactly what you have to do and no deviation from that. It's going to have little individual deviations. So I hope that was a little bit instructive. I am so glad to have you all here today and to be learning along with me. I really enjoy your comments. Please email me if you have a paper you would like me to look at, or if you have comments or questions. I love talking about this all day, and I do. So feel free to contact me at Leslyn@lipedemaproject.org. And I look forward to joining you again next time.